Assalamu alaikum. Bismillahirrahmanirrahim. In this video, we are going to discuss about the Norma Occipitalis. First of all, we will see its shape, bones which are seen in this norma, and then the sutures which are present in this norma, some other features and attachments on the Norma Occipitalis. First of all, the shape of Norma Occipitalis is convex upwards. In the upper part it is convex and on the lower part it is flattened. And then we will see the bones which form this norma. First of all, the posterior part of parietal bones, these are parietal bones and these are the posterior parts. And then upper part of the occipital bone, this is the upper part of squamous part of occipital bone. And the third is mastoid part of temporal bone. These are the temporal bones and this is the mastoid part of temporal bone. As we will see, the mastoid part of the temporal bone is shown. The sutures which are shown in this norma is the upper part of lambdoid suture and upper part of sagittal suture, and this is the lambdoid suture, and this is the occipitomastoid suture. This is the suture which are present between the occipital bone and the mastoid part of temporal bone. Occipitomastoid suture, and this suture is present. This is called parietal bone from parietal bone, parieto, and the mastoid part, parieto-mastoid suture. In this way, 4 sutures are present in this norma. Some other features are present. This is called the lambda. Lambda is the point where the sagittal suture and the lambdoid suture meets. This point is called lambda. And the parietal foramina also present in the posterior part of the sagittal suture, and oblivion is also present, which is present between this is a point between the two parietal foramina. The second point is the external occipital protuberance. This is called external occipital protuberance. This is the point where the junction of head and neck meets. The median point, this prominence, the prominence of the external occipital protuberance, this point is called the inion, and above this point is a present occipital point. This point is called the occipital point. This point has the importance. It is the farthest point from the glabella. Glabella is the point between the two superciliary arches. As we will see the diameter from this point, this is the farthest point from the glabella, which is called occipital point. And on the each side of the external occipital protuberance, we will see superior knuckle lines and inferior knuckle lines. The superior knuckle lines are curved bony ridges. These are present. These are called superior knuckle lines. The area below the superior knuckle lines will be studied under the Norma Occipitalis. Sometimes 1 centimeter above the superior knuckle lines, some other lines also present. These are called, at this point, these are called highest knuckle lines. These highest knuckle lines begin from the upper part of external occipital protuberance, and these are more curved as compared to superior knuckle lines. And then we will see the mastoid foramen. This is the mastoid part of temporal bone, and this foramen is called, and this foramen is shown. This is called mastoid foramen. Through this mastoid foramen, emissary vein and meningeal branch of occipital artery pass. And then we will see interparietal bone. These are also called Inca bones. Actually, these are not the normal feature. This is not the normal feature of the occipital bone. Interparietal bone is not an sutural bone or an accessory bone. Actually, this is the membranous part of the occipital bone which fails to fuse the occipital bone during development. Actually this bone is also present in this skull. This is called interparietal bone. This may be in triangular shape. This may be one or many. I have seen many skulls which possess 3 to 4 interparietal bones, and this is not the normal skull. And now we will see about the attachments which are present on the Norma Occipitalis. The upper part of external occipital protuberance, its upper part gives origin to trapezius muscle, and its lower parts gives origin attachment to ligamentum knuckli or knuckle ligament. This is superior knuckle line. This superior knuckle line also gives origin to trapezius. Trapezius originates from the upper part of external occipital protuberance and then the medial part of superior knuckle line, and the lateral part of superior knuckle line provides insertion to sternocleidomastoid. Here the sternocleidomastoid muscle inserts. It is the upper part, and the lower part gives attachment to splenius capitis muscle. If the highest knuckle lines are present, then these give origin to the on medial aspect it gives origin to epicranial aponeurosis, and on the lateral aspect this line, highest knuckle line, gives origin to occipitalis or occipital belly of occipitofrontalis muscle. If this is the case, if highest knuckle line is present, and if the highest knuckle line is absent, these structures are also originate from the superior knuckle lines. Hope you will enjoy the video. If you like this video, then subscribe our channel and share with your friends. Thanks for watching.